One thing they don't talk about in the hospital is like how much stuff you're hooked up to. I have this in my hand for all the IVs. One of them is just a fluid for hydration. The other is Pitocin. I have to wear this blood pressure cuff, which is so tight. This was another site where they tried to put this in first and it didn't work, and now this arm's in pain. I've got, wait for it. I've got 2 belly bands here. One is monitoring my contractions and the lower one is monitoring the baby's heart rate. And then I have an epidural in my back. So there's like a whole taped thing on my back with a thing. I have a catheter coming out of my urethra, and then my 2 legs. Hold on. Pressure. It's okay. And then because of the epidural and them wanting to keep the circulation, I have these 2 cuffs on my legs.
All right, I want to fly through all of these really quickly, but I think it's really important for you to know if you're going into birth for the first time or getting an epidural potentially for the first time. The blood pressure cuff on the arm, I want you to know that that can actually be removed. There are certain blood pressures that have to be taken after the epidural, but when you're doing well and all is normal, that cuff can come off and they can put it back on when they need to check you. If you feel like yours has been on for a long time, you can ask them to take it off and just put it back on for your next check. IV has to be in place before the epidural gets placed, and then obviously it's still in place after the epidural is placed. You're probably gonna get a lot of fluids through it, at least 1 liter before the epidural is placed or during and after they want to give you those fluids. Urinary catheter, super common too. This is because we don't want your bladder filling up and you no longer have the urge to go pee, right? So unless you're really close to delivering, and they might do a straight cath and kind of in and out, empty your bladder really quickly, they are very likely going to put in an indwelling catheter like she has, and they will take it out when you are pushing and getting ready to deliver baby. Epidural, yes, it gets put in your back. No needles left in your back, but there is like a catheter, a line that comes up your back, and they will tape it up your back typically, kind of up towards your shoulder, and then the rest of the line will go off your shoulder. The SCDs, sequential compression devices, those are the things she's talking about that are squeezing her legs. Really common after a cesarean birth too, just so you know. And those kind of keep blood flowing and keep things moving, since you are going to be more stationary after you've gotten an epidural. Last ones, those fetal monitors and the contraction monitor, those are going to stay on once you have an epidural the entirety of the time until your baby is born. Lastly, she is right that it is hard to move, but also you can still move. All of these things are a very normal part of getting an epidural. They are expectations. None of this is abnormal. So that means you can still move with an epidural. If your nurse isn't helping you move, or maybe it feels like they're using that as an excuse to not flip you around, you can absolutely ask for their help so you can keep moving.